Welcome back. Just before the break, we were talking about diabetes, type 2 diabetes specifically. And of course, this has been very much in the news this week after celebrity chef Paula Deen came clean with an admission that she herself has been suffering from this disease for the past 3 years. Our guest is Dr. Assil Saleh. She is an internist with Foxhall Internists in Washington, and she's here to shed some light on this disease. Good to see you, Doctor.
Great
Thanks so much.
to see you. Thank you.
So let's start with a definition. What exactly is type 2 diabetes?
Well, it's the most common form of diabetes. It's when the body's no longer able to make insulin, or the body becomes resistant to insulin. So there's a buildup of sugar in the blood and sugar products in the blood and different organs. And it can lead to a lot of complications, including heart disease, strokes, heart attacks, kidney failure and dialysis, nerve damage, and so on. So it's a pretty significant condition, and it's one of the leading causes of death in the U.S. and worldwide.
Pretty scary. How does it differ from type 1 diabetes?
Type 1 tends to be a little more immune-mediated disease, so there's a lot more genetic predisposition to type 1.
Is that what's called juvenile diabetes?
That is exactly right. Juvenile diabetes constitutes about 10% of diabetes, but type 2 diabetes is the most common form. 80 to 90% of diabetes, when we refer to diabetes, is actually type 2 diabetes.
Yeah. Now, is that more prevalent in adults?
It is, although there have been some cases of type 2 diabetes described in the pediatric literature, but it is much more prevalent in adults. And one of the risk factors is aging. As we age, as we grow older, we are more predisposed to developing type 2 diabetes.
Celebrity chef Paula Deen has been under fire this week because of her what's perceived to be unhealthy cooking techniques. She likes to use a lot of butter, she likes to fry things, and high calorie, high fat, high carb kinds of foods. So what is the component with what we eat and type 2 diabetes?
Well, first of all, I think I'd like to express our gratefulness for people like Paula Deen to come out and talk about their medical conditions, because they put type 2 diabetes on the spot. And I think it's very important for us to educate people about this condition. She said not long ago that it is not a death sentence, and that can be true. If we modify our lifestyle, that can be very true. The risks for developing type 2 diabetes include being overweight, being obese, and lack of physical exercise. So those are very important in trying to prevent the illness or modifying the way it can progress in the future.
In addition, would age be a factor, and what about stress? Absolutely.
Stress is a factor, and if possible, they can modify their lifestyle so that it's less stressful, can be beneficial. Age is a factor. Age, as I said, as we grow older, age 45 and older is a predisposing factor to developing the illness. Genetic predispositions of family history of diabetes and so on is also predisposing.
Now, is it true, Dr. Saleh, that you may have type 2 diabetes and not even know it? I mean, is it true that some people don't really suffer from symptoms that they're aware of?
That is absolutely right. Whereas most people with type 1 diabetes have more typical symptoms of diabetes, type 2 diabetes can be completely quiet and quiescent. So it's very important for you to visit your doctor for your annual physicals and get screened for it, particularly if you have risk factors.
And what do you do in a screening?
We do a fasting blood sugar to start with, and of course a urine test to make sure that people are not spilling sugar in their urine. So that's a very simple screening tool to start with. And it's interesting that there's so many people out there with pre-diabetes, which is another condition that can lead to diabetes. And that is a very important time to intervene and try and prevent the progression and actually reverse the progression into...
That's what I really wanted to ask you. If you have diabetes, can you reverse it? But I guess if you have pre-diabetes, you can. But can you also, once you're in full-blown type 2 diabetes, can you ever reverse it, or is that chronic?
It's a chronic condition. It's difficult to reverse, but it's very possible to delay the progression and to delay the potential for complications. So heart disease, like we said, heart attacks, strokes, and so on, and kidney failure, all of that could be prevented it, eye disease, blindness. It can all be prevented with good management of the diabetes along with lifestyle modification, so exercise and diet and modification in our lifestyle. It's very important to bear that in mind when we're treating people.
So there is a positive element to this as long as we get educated and find out what we need to do.
That's absolutely right. That's absolutely right.
Let's talk about some of those warning signs that are obvious. There are some things that show up as symptoms of diabetes, right?
Sure. Things that you can look for are if you become very thirsty, unusually thirsty, if you start going to the bathroom frequently, if you develop recurrent infections, women, recurrent urinary tract infections or other form of infections, fatigue, irritability, moodiness, all sorts of very unusual or very non-specific symptoms, sometimes weight loss. So if you're not feeling well and you don't feel like yourself, do seek medical care because it might be a precursor or a potential diagnosis of diabetes.
And a simple blood test will let you know.
That's exactly
if you need to make some changes.
That's exactly right.
All right, Dr. Assil Saleh, thanks so much for coming in.
Great to see you.
Important message today.
Thank you very much for having me.
Up next, forget the beach. We're going to tell you some much more affordable places where you can go this winter. Natasha's going to have more on that in just a couple of minutes. And in the meantime, if you want to weigh in, please do. Talk to us on Twitter. Let's Talk Live DC. We'll be right back.